Hey guys, we may have gotten our problems fixed with the internet. Just a little tweak on the old router, and I think that I'm able to do live YouTube again without all of the horrible interruptions, at least so far. So I'm really looking forward to giving this a try. We didn't put announcements out on Twitter and Facebook like I normally do because this is just kind of spur of the moment, and I just wanted to do, we can make it as big as we want and cover as many questions as you guys want. I have no time limit on it except for the battery on the phone. It's about 50%. Candy Lover 101, thank you. Hi. Always good to have you be a part of things. Butterfly Girl, you're here too. Hey, how are you doing? Lindsay Antoine, oh, of course, always good to see Lindsay. Lindsay and BooBoo Kitty, of course. How can I say one without the other? Howdy, BooBoo Kitty. So good to have all you guys here. And Crystal Shannon, hi. Now, I know it's Thursday night, and nobody voted for Thursday night. It was all, what nights was it? I remember Sunday was one of them, because I'm thinking Sunday nights might work, because it's halfway between our Friday video release and our Tuesday video release. So that might work out really well. But I saw an opportunity to do this evening, so I wanted to do. Plus, I was kind of anxious to see how well this works. So if you guys do have the medical topics you want to touch on, please feel free. And if you want to share this with friends, if they want to jump in, that's fine. A little lower numbers than usual because I didn't announce it everywhere. Cheryl, good to see you here also. And Gwen Vaughan, Dr. Gwen, I could be watching Grey's Anatomy. Yeah, but Grey may not want you to see his anatomy, so that may not be nice. That might be kind of invading somebody's privacy. BooBoo. What? Oh, LeeAnn wants to know how the aquarium was. BooBoo Kitty. What? It's Thursday. I know. Consider it a bonus. Let me move somebody's glass here before I knock it over, waving my hands so much with my speech. So, yeah, Dr. Gwen, let's see. Are you south or north? I think you're south still at this point in the week, but I don't know. As of 15 minutes here, Cheryl. Okay. And Aniada? And Anada? And Aniarda? So we're happy to have you here too. Crystal has a question. Okay, let's get started. How is lupus diagnosed? I've been told to get referred to a rheumatologist. So, Dr. Gwen, we're going to be talking about diagnosing lupus, which, by the way, a certain patient of yours that we were trying to refer to endocrine, that I changed the referral to urgent so she'd get in sooner, the endocrinologist said, the endocrinologist said, we don't do referrals for fatigue. So, I haven't done anything with that referral yet. If you have suggestions for me, you can somehow get them to me. I didn't take any action on it today. Okay, so lupus. Oh, and Candy Lover 10111 says, I am scared tomorrow. I have a meeting. I hope I get good. I hope you do too. My mom knows you. J3R3M7 space B. And the Fluffy Duck says hi. Hello. That could be. There are some people who do know me, and they do occasionally get on YouTube. In fact, my first patient of the day, I walk into the room and he says, oh, you're staying up late doing YouTube. I was trying to get to whatever we had the appointment for. He wanted to talk about me staying up late on YouTube last night, so he knew. Really? Lol. Translation, Jeremy. And Lindsay, Candy Lover, best of luck. I'm blowing off homework to watch Lindsay. I don't want to be a bad influence. So, how do we diagnose lupus? How is lupus diagnosed? Lupus is one of those diseases, kind of like syphilis, that's a great imitator. It has vague symptoms. It has rashes. And, of course, rashes can look like many other rashes. And, of course, there's classic rashes for it. Hi, Taylor. Thanks for being part of things. And this one, okay, so the classic rash is the so-called butterfly rash or malar rash. It's on the cheeks and it spares the nasolabial folds. My mom works at the large animal clinic and lol. The often has arthritis with it, often has fatigue with it, and what else, Dr. Gwen, for lupus? Classic things with lupus. Those are the main ones. Oh, it can also have effects on the heart. Can have problems with the blood, clotting problems. So the lab that is drawn for it involves lots of panels. One of them is called ANA. We also look at markers of inflammation, which are as generic as a test can get. Oh, Charlotte says, I was diagnosed with RA and lupus when I was 25. Lupus went into remission, yay, after methotrexate for 15 years. Just got re-diagnosed a few was ago, was put on Plaquenil. And interesting you bring up the medicines. We're going to be talking about that in a little bit, Charlotte. I'm glad that you have the Plaquenil, though. Butterfly Girl, you can die from lupus? Kind of. Cheryl McNutt, be careful, boo-boo. Lindsay developed Raynaud's a year and a half ago. I had to get tested for lupus because there's some similarity, and sometimes we can't tell one from the other to a certain extent. And Crystal Shannon, I have a butterfly rash, pretty severe pain like arthritis. The blood test didn't detect an RA factor, but the NP said the rheumatologist had more in-depth testing. Yes, we'll get to that. Yes, and Lindsay, we're glad you don't have it either. Circulation issues, yes, we touched on that a little bit. Can you put lupus, have negative blood work? Usually there's going to be something when you're getting 100 different tests, you know. It's kind of hard for them all to be negative, but at the same time, if you test for anything that has that many different tests, okay, I'm exaggerating with 100, but there's a lot. Actually, you know what? There may be a rheumatologist who actually does get 100 different blood tests in their panels. I'm not going to say that's impossible because, yeah, ANA, okay, you say positive ANA. Do you know how many different elements there are to an ANA panel? So if just one of them is positive, the anti-DNA is one of them. So you get all these results back. And here's another thing. They're not necessarily just positive or negative. Sometimes they're a numeric value. And so you'll have like a normal range, and then you'll have this numeric value that is either just above the normal range or just at the high end of the normal range or kind of halfway between the normal range and a so-called considered high value. So these are just, there is no one set of results that a rheumatologist will look at and say, every patient that comes in that has these results, they have lupus. They won't. They'll take into consideration the clinical picture, which kind of makes you wonder why they're ordering all of those labs if they're going by clinical impression. And there's a lot of that in medicine where, you know, the diagnosis needs to be made by a physician, not by a blood test or an x-ray result. Lots of times this is the case. Okay, Cheryl, tube not working for something. So that's the frustrating thing, at least for a primary care doctor, of lupus or other rheumatologic disorders, so-called autoimmune disorders. There's just no firm thing to put your finger on and say, that's what this is. And rheumatologists that do it all the time are much more qualified to look at an individual patient and think. And even patients they've been working with for years, they'll change what they call it. They'll go from saying, okay, maybe it's not lupus after all. Maybe it's rheumatoid arthritis, or maybe it's Sjogren's syndrome, or, you know, all the different autoimmune diseases. And we see this on our end with the notes that come in, and sometimes they won't commit. And sometimes they'll call it like seronegative rheumatoid arthritis, meaning the blood tests are negative, but clinically it looks just like rheumatoid arthritis, and so they'll treat it as if it is. So you guys are talking to each other here while I'm talking. And that's good. That's building community, so go ahead and keep it up. Missed a lot of those comments there while I was answering the question on the lupus, but I guess that's kind of how it goes. I think you guys want me to actually answer the question. So if I'm in the middle of really going answering a question, you put your question or your comment up. Don't feel bad if I don't read it. If you definitely want it read, use the super chat, because people use super chat, get read, and stay up there, and they will definitely get their questions mentioned, not necessarily answered. It depends. If it's too personal, it may not get answered. Pamela says, I've tried Lyrics. I'm thinking you're talking about Lyrica. You guys are having a conversation about using Lyrica for some type of pain. Lyrica not being one of the immune modulating drugs you'd use for lupus or rheumatoid arthritis, but rather a medicine used for nerve pain in situations like fibromyalgia. Neurontin and Lyrica, yeah, Charlotte, Neurontin is very similar. Neurontin, the generic name is gabapentin, and the generic name for Lyrica is pregabalin. You can see they both work on GABA. And BooBoo Kitty's talking about a snowbank, and we also have Butterfly Girl having a friend diagnosed with polycystic disease. Are you sure it's not polycystic ovaries or polycystic kidneys? Usually it's some organ. Say hi to Austin Coleman. Okay, Austin Coleman, hi. And Pamela is using something for leg nerve pain, one of the GABA agents, which are actually anticonvulsants or anti-seizure medicines. Only 14, don't have a clue what you're talking about. Could you explain it to me real quick? Probably not. If it's a super complicated thing, usually it can't be explained real quick. At least not and do it justice. Crystal, Neurontin didn't do much for me other than make me feel hungover. Yeah, that's kind of the downside of it. Although, I do believe that the Lyrica isn't as bad for that side effect, but it costs more. Candy Lover 1011, what is lupus? I'm only 10. Butterfly Girl, I think it's her pancreas. Lupus is a disease where your body fights itself. So just like your immune system fights off infections, viruses, and bacteria, those weapons used against the viruses and bacteria are instead used on your own body's cells. And it depends on which autoimmune disease you have. Immune being the system of the body that fights things. Autoimmune meaning it's fighting itself. Depending on what those antibodies that are a part of your armamentarium, those are the weapons. Depending on what those antibodies are against of your own body's proteins, what the body's made out of, will determine what the symptoms are. Like if they're against certain type of tissues, you'll have lupus. If they're against another type of tissues, there'll be rheumatoid arthritis. It can be just allergies. Allergies are an autoimmune disease. It's where when you're exposed to the pollens, you get this hyper response of the immune system doing weird things like making you sneeze and have runny nose or wheeze. All right, let's back up a little bit here. Pamela tried all those, currently have spinal cord stimulator. Those are good. Oh, Claire. Welcome, Claire. Claire's one of the special ones. Dr. Vaughan, would Proteus bugs in urine and recurring infection be cause for referral to a urologist? Possibly, yeah. Proteus. Dr. Gwaine, if you're there, can you help me with what this is? Proteus mirabilis? Is that what we're talking about? Proteus, the genus of bacteria? If it's recurring, recurrent urinary tract infections will refer to urology. And if we've actually grown Proteus in your urine, and not able to get rid of it with finding antibiotics through a culture and sensitivity that work on it, there'd be reason to check out urology, maybe have them kind of look around and see what's going on. Sometimes they'll do a cystoscopy where they put a scope into the urethra and into the bladder to look to see if there's something where the bacteria are getting caught and living. Look at that. People just walk through here. Hi, hello. I was going to call you Gwaine, but Gwaine's on here. This is Ethan. Ethan, did you say hi to all the nice people?
I waved.
He waved. There he is. There's Ethan. Some of you might remember him from the pole vault days. And upcoming pole vault, right?
13 feet, hopefully.
13 feet. We're shooting for 13 feet at the next meet. Okay, 2 types, but I'm wondering why it's a concern. If it doesn't respond to antibiotics, it's a concern. Not necessarily because it's Proteus. Oh, I saw Dr. Gwaine said something here, so let's back up. And if I'm not getting to your comments or questions, you can always use the super chat because there's so many people commenting, which I love. And let's see. So we talked to Claire. Best treatment for toenail fungus, always back. Love Nesquik on the top of the fridge. Yes. Vesica ureteral. There's another one. Thank you, BooBoo Kitty. That's something else they're going to be checking for when they're doing the urologist does his evaluation because they have tools we don't have. Vesicoureteral reflux is where the bladder, instead of squirting everything out the urethra, some of it backs up into the ureters toward the kidneys, and that can also contribute to having recurrent urinary tract infections. Another question is possible side effect to be the first felt behind the knee. I guess it is. Like penguins. No, I don't like penguins. Amitriptyline and MFCS, whatever it's called today, yay or nay. Amitriptyline and MECFS, whatever it's called today, yay or nay. Amitriptyline. Are you talking about all of the tricyclics? Amitriptyline, yay or nay? Amitriptyline, yay when it's used correctly, not as an antidepressant necessarily because of the side effects. Candy Lover 101, thank you. New studies for pain, nothing's working. I'm queen of allergies, the infamous atopic triad, dermatitis, asthma, and allergies. I'm sorry. Queen wasn't, yay, there's two types, but I'm wondering why it's a concern. Do you think that you can make humans live longer by altering the chromosomes? Yeah, I think so. Hi, Charlotte. Sup, Ethan. High five, Lindsay. No asthma, but multiple allergies. Okay, so we got all caught up with all of your comments there. Didn't answer everything necessarily, but we got through it all. Yeah, allergies and the rheumatologic disorders or autoimmune diseases, there's similarities between them. Having that souped up immune system. Immunologists, rheumatologists, it's the same fellowship for the two. They also work with people who have poor immune systems. The opposite. Butterfly Girl says, I think my friend has polycystic disease in her pancreas. What is polycystic disease and how do you get it? You just do. There's no action you take, it just develops. And not all that used to people having polycystic pancreas, certainly ovaries and kidneys, and there's certain treatments that are used for each of those, depending on which one it is, to help make it better. The one that comes to mind is metformin for polycystic ovaries, I believe it is. Why? I don't know why you're using diabetes medicine for polycystic ovaries. It's kind of strange, but apparently it helps. Would stress exacerbate lupus out of remission? Yes, Charlotte, it would. Hey, Doc. Hey, McNuggets lover. And amitriptyline off-label use, I think some talk about insomnia, pain, helping myelitis. Yes, amitriptyline is one of the most effective medicines for nerve pain. It's also very effective for chronic insomnia. Although, I will say, the more I practice medicine, the less enthused I am about using any medicine for insomnia, because most insomnia is behavioral, not chemical. But people don't like to be told they have to not sleep during the day and sleep in a regular place and sometimes go without sleep for a night in order to improve their sleep overall. They'd rather take a pill that they then become dependent on. And I disagree with that practice. That's why I personally don't take a pill to help me to sleep. Splash Brothers, my finger is cut open under my fingernail. Wash it every 30 minutes. What do I do? Go see a doctor. I rescue dog's life. What's a high bilirubin? I told I have it, but so there's nothing to do about it. I think you're talking about Gilbert's disease. Dr. Gwain can certainly speak very much about this, or his little brother, where people do. They just have a higher bilirubin than the lab's normal value, because the lab's normal value is based on people who don't have a high bilirubin. It's not actually normal. It's normal for a certain segment of people. There are people who have a higher bilirubin. And unfortunately, it's been given the term Gilbert's disease. Maybe it should more accurately be called Gilbert's trait. Gilbert being Gilbert. I guess it's French. Some people might call it Gilbert's disease. It's not a disease. It's just that you don't process bilirubin the same, and so you have a higher indirect bilirubin, and thus a higher total bilirubin. Just because I'm true from my Gilbert's disease. Just because you're true from yellow, not true. Just because I'm yellow from my Gilbert's disease? Is that what does it? Coconut Heads, do allergy relief pills help you sleep? If they're sedating, they will. Like Benadryl is a sedating allergy pill. I guess you could call Vistaril or hydroxyzine a sedating allergy pill, although it's not usually sold for that and it's prescription only. Lindsay, don't jaundiced babies have high bilirubin? Why, yes, Lindsay. Jaundiced babies and jaundiced Dr. Gwain both get high bilirubin, and his little brother. There are some allergy pills that don't help you sleep. The non-sedating antihistamines like Claritin and Allegra, they don't make you sedate. Although if you take enough of them, I think the warning says even they can do it. Call me Austin. Absolutely, I will do that. So, yeah, some people with Gilbert's disease, you can actually see some yellowing of their eyes when they're under stress, and it's not because there's any problem that needs to be addressed. It's just the way they are. That's normal for them. Splash Brothers is my username. Okay, Austin. But if you put up comments and it just says your username, I'm going to read the username. But for now, we know that Splash Brothers is Austin. And the person who thinks their mom knows me, who's 10 or 12, 14? Fibrodysplasia ossificans progressiva. What is it? Progressiva. Well, that would be a progressive version of the fibrodysplasia ossificans, which is a problem with soft tissue. I heard that you can develop a tolerance to Benadryl. That I do not know for sure. Many things you can develop tolerance for. Benadryl, I don't know. I'd guess if somebody uses it all the time, they might even be able to get tolerance to that. Probably not as quickly as the benzodiazepines and the so-called Z drugs like zolpidem. Kevin has a question. Is Tylenol better than ibuprofen? In many ways it is, even though you can't make such a statement because you have to define what better is. I would say better is in that it has less chance of hurting your body. Certainly less chance of hurting your kidneys, certainly less chance of hurting your stomach. But in an acute overdose, Tylenol probably has more of a chance of killing you than ibuprofen. So which is which? So generally, if people aren't going to be overdosing on a drug, I'll tell them start with Tylenol. Make sure not to take more than 3,000 milligrams a day, and you'll probably be absolutely fine unless you're the rare individual who has some kind of horrible liver disease like cirrhosis from horrible alcoholism or horrible abuse of other drugs that have eaten up your liver like testosterone. Becca Wheeler says, thoughts on the book, Eat Fat to Be Thin, Another Low-Carb Diet? Thoughts? Don't know that book. I think that principle could easily lead to people causing problems. But the low-carb principle, the way it works is if you eat less carbs without overdoing the fats and proteins, you're going to eat less total calories, and you're not going to be made hungry because carbohydrates stimulate hunger. They are not satiating. How do you know when you're done with a bag of Doritos? When it's empty. That's it. Don't tell my wife I said that. She hears me. She had to take away the Fritos from me today. Mental note, acetaminophen is dangerous. No, I know. I didn't want you to get that message. For most people, it is not. For those who overdose on it, it is. Here's the reason. When you take acetaminophen in the normal dose, your body processes it very nicely with no toxins. When you overwhelm your liver's capacity to process acetaminophen, it runs out of a certain substrate. And when that substrate runs out, it substitutes with something else, combining it with part of the acetaminophen, making liver poison. But that rarely happens. It only happens when you run out of the normal substrate. So that's a diseased liver that's happening in, or a huge overdose that greatly overwhelms your body's capacity. So as long as you stick to 3,000 milligrams max a day and you have a normal liver, you're going to have no problems at all. All right, Lindsay, what do you say? Everybody, we have it on Doctor's Authority. Finish the bag of... Oh, my goodness. What am I creating here? Charlotte, take in moderation. Yes, Lindsay, listen to Charlotte. Take your Doritos in moderation. Kevin, what are your thoughts on colloidal silver? Hey, who wants to tell them my thoughts on colloidal silver? Kevin, go watch our video that's actually got colloidal silver in the title. It's 2 videos. I won't restate it here in front of everybody. It's already watched it. Crystal, while Miss Wilson 861 is melatonin safe for long-term use. I do not know of any dangers with it. I'll say it that way. Butterfly Girl, did you post that earwax removal video tomorrow at 4? Charlotte, lol, Lindsay, Brenda, need energy. What's best thing to do? Get sleep. Exercise regularly. Don't eat trash. No colloidal silver. Lindsay's crying her eyes out at something we did. Would hemochromatosis be sensitive to acetaminophen? I can't think of a way that it would be. Candy Lover 101, what do you recommend for stomach pain? Stacy Thompson, I think my liver is enlarged from prolonged Tylenol. Crystal, so ready for the video. You're talking about the new ear. Splash Brothers, which I'm supposed to call Austin. Do you think there will be a cure for cancer in the next 30? What do you mean? There's already a cure for cancer. Belinda Fisher, I travel a lot and don't eat right. Is there a good supplement for energy? No. Eat right. Get exercise and get sleep. Coconut Head, I use Q-tips for my ears. Don't tell me how to live my life. I would never presume to tell you how to live your life. Don't use Q-tips. All right, going back a little bit here, we have I'm sure I missed something back here. It can be dangerous. In moderation. What do you recommend for stomach pain when you travel a lot? Eat right. Desperately need. Okay. I know I missed. Oh, this is something I don't remember reading. Yeah, yes. Oh, I'm sorry. I need to let TMXS13 know that Tylenol is paracetamol. Yes, it is. In our country, we don't know it by that name. Deborah Bradshaw, I'm prescribed 3 metformin daily for my type 2 diabetes, but if I only eat 2 meals a day, do I really need to take the 3rd metformin? I don't know. Is your hemoglobin A1C still above goal? That's how I would determine it. And by the way, metformin isn't all that crucial to be taken exactly. It lasts for a while. So if you're taking it twice a day, you're probably going to get 24 hours of metformin activity in your body. But it is more active close to when you take it, so you do want that to correlate with the meals as best you can. So sometimes it's better to take 2 of them with a big meal rather than take 1 later in the day when you're not eating anything. All right, coming back to, Dr. Gwaine, hemochromatosis can affect the liver just... Oh, is that what we were getting at? That hemochromatosis can cause liver disease and make you more vulnerable to having problems with acetaminophen. So if the hemochromatosis is causing you to have injury to liver, raising your liver enzymes, we're going to tell you take it easy on acetaminophen or not take acetaminophen. Thank you, Dr. Gwaine, for interpreting that for me. BooBoo Kitty, higher levels in the blood that cause liver damage, hemochromatosis. Gwaine, Tylenol. Lindsay Bailey, my husband and I were diagnosed with infertility, usually low sperm count and low motility. Any recommendations? I would guess that you're already getting the recommendations from whoever did the diagnosis. If not, I recommend a workup with a fertility specialist who will go into great detail on that and try to collect some sperm that will work and probably recommend in vitro fertilization. Belinda Fisher, what do you think about the naked juices made from all juice? At least that's what it says on the bottle. Fruit juice. I like fruit juice. Fruit juice has good nutrients in it, but it also has a lot of sugar. So it's better, instead of drinking fruit juice, to eat the fruit. So at least you get some of that dietary fiber as you're getting all of the great nutrients and calories and flavor from the juice. Can liver go back to normal if I stop taking excessive Tylenol? Sometimes you can have liver improvement. So I won't say it's absolutely no. Austin says, is it really dangerous to sleep with gum in your mouth? If you choked on it, it would be, yeah, because it could obstruct your airway when you have your muscle tone relax in your sleep. You're right, BooBoo. Tylenol should be avoided if possible. Hemochromatosis. Deborah, thank you, Dr. Wayne. Deborah Bradshaw, great answer. Claire Westmoreland, I saw in the news today that a man died today, many men died today actually, from taking anodin. Don't know that one. For 3 years, opens the topic for long-term use over-the-counter medication. Anodin. Anacin? An aspirin-containing pain reliever, maybe? Sugar, rescue dog's life. What do you do other than shots and pills for B12 deficiency? Level is not always detectable. I have the same for vitamin D with level of 2. What do you do other than, I think that's supposed to be then, shots and pills for B12 deficiency, other than shots and pills? High meat consumption? Dr. Gwaine, you got an answer for that, different from that. And then for vitamin D, sunlight. Of course, then you have to balance that with increasing risk for skin cancer. Also, some people can use certain wavelength lights to help their body to make vitamin D rather than using actual real sunlight. Mom Siga says, what is the anodin? So do I. I say, what is an anodin? Charlotte Green's having a blast. Brenda Fisher, I think this live chat is nice. Thank you, Belinda. I appreciate your advice and love the videos. Thank you. I appreciate that. Temexis 13, anodin, paracetamol, aspirin, caffeine, compound. Thank you. Thank you. Yes, Temexis, don't put your consonants together if you want me saying your name. Temexis 13, anodin is paracetamol, aspirin, caffeine, compound. So that would be the same thing as our Excedrin. And you can also kind of do your own Excedrin by getting 2 Tylenol, 2 aspirin, and about 100 milligrams of caffeine worth of either coffee or soda if you aren't able to actually get Excedrin, but you're able to get the components to it. So if somebody was eating that all the time, apparently they got too much if it hurt them. If you're taking it at the recommended dose, that shouldn't cause a although I guess prolonged use of aspirin can cause injury to the lining of the stomach. Yes, aspirin can cause ulcers in some people, but Tylenol is not causing the ulcers, it's the aspirin. Austin says, you say a lot of big words, but I don't understand. This is how you learn what they are. Hearing them over and over and over in the right context, you'll learn what they mean. What is your favorite fruit? Mandarins? Talk about pernicious anemia. Dr. Gawain wants us to talk about pernicious anemia, where you lose the ability to absorb vitamin B12. Sometimes happens to people when they have gastric bypass surgery because a part of the intestines that do what it's supposed to modify food as it comes through, it's gone. So where it was going to be absorbed further down in the system, it no longer can be absorbed because the job wasn't being done further out. That's what pernicious anemia is about. Sorry, I can't use more specific things. Okay, I'll say intrinsic factor. Intrinsic factor in the stomach. Somebody help me. What does it do? Intrinsic factor in the stomach does something with the vitamin B12 so that when it gets down lower in the system, you can absorb it. Or is that, yeah, that's right. Isn't that right, Dr. Gwynn? So I guess you could give intrinsic factor if that was a cause of vitamin B12 deficiency. I wish more of my favorite YouTube doctors would live chat. This is a wonderful tool. You know what? They probably will if they knew about it. Just tell them. If an ultrasound is done when a blood clot is suspected, would the radiologist be alerted immediately? Possible cellulitis? Yes, sometimes cellulitis can look like a blood clot in the leg because they both cause swelling. Sometimes they can cause redness. They both cause pain. Would the radiologist be alerted immediately? Yes. Whenever there's a positive finding like that, actually the radiologist is going to be the one who alerts whoever ordered the ultrasound. What year did you become a doctor? 1996, Austin, and Dr. Gawain did in 2008. Awesome, Dr. Gawain. Now, how did she say awesome, Dr. Gawain before he said something? Oh, because he said pernicious anemia. You're getting at him for that. I see. So BooBoo Kitty chimes in with, would the other doctors promote Dorito? You're going to be the end of me, BooBoo Kitty. The Dorito diet. I didn't say to eat them. I just said when you eat them, you finish the bag. Coconut Head likes Doritos. Everybody likes Doritos. That's why they make them. It doesn't mean they're good for you just because we like them. Dr. Gawain wouldn't. He would not approve or promote the Dorito diet. He would eat it, but he would not promote or approve it. What else would Dr. Gawain eat? What else have I seen Dr. Gawain eat? What can we come up with? Audrey likes Cheetos. Everybody likes Cheetos, except for the stuff on your fingers. Lindsay, you're cracking me up. Love the grammar, spelling correction. You like it when I correct things. Claire, what are you doing up so late? When you worked in the ER, what's the strangest or funniest case you had? In Rescue Dog's Life, I have never had Doritos. Rescue Dog's Life, you are my hero. Claire, strange things. Boy, I know what Dr. Gawain's is. Mine, strangest was probably be when, I have to do a little visual for you here. So to intubate a patient from a trauma, you lay them, well, they're already down in a supine position. And you're at the head, and you put in the laryngoscope to push their tongue down, and you'll move it up this way, and it moves the bottom of their mouth away, and you look toward their throat, and you can see the opening to their airway. You see it open up there. You see the epiglottis, and you get it out of the way so you can put an intubation tube in there. Well, I remember one case of horrible trauma. There was a car accident, windshield sliced through, and there was this cut that kind of went down like this in the back of the nose, and I was able to see what I was doing not by looking in the mouth, but by looking down through the nose into the throat, and able to see how I was intubating that patient. I don't think they survived. BooBoo Kitty says, cook your food in a cast iron skillet. Is that to try to get more iron? Is that what that was all about? Somebody's given the ingredients to Amidin. Paracetamol 200, which is a tiny, oh, I guess if you take 2 of them, you'd get 400 milligrams of paracetamol. Aspirin 300 milligrams, that's a fairly normal dose. Actually, here it's 325. Caffeine 45 milligrams. So, yeah, it's around 100 milligrams of caffeine if you get 2 tablets, which usually I recommend taking 2 tablets. Austin, what sports do you like? I like airsoft. Charlotte, do they still do gold shots with rheumatoid arthritis and lupus? I haven't heard of gold being given since I've been in practice. I think that's more of an old thing. They kind of now do all of these fancy immune modulating or DMARDs. What's DMARD stand for? DMARD, M-A-R-D. The D is for drug. DMARD? Drugs, DMARD. Medicines, Anyway, immune modulating drugs is what they call them. Backing up a little bit here. This disgusting case. Oh, I've talked about some disgusting things before. Dr. Gawain runs a lot. Oh, that's why he's able to eat things. Like crack nom nom Cheetos. Message retracted by Lindsay. Ooh, I wonder what it was. Never had Doritos. He runs a lot. Lindsay, do as Dr. Gawain says, not as he does. Cheryl McNutt, why does lithium work with mental health? Because it stabilizes membranes and keeps them from misfiring. The nerve cells, that is. What's the most disgusting case? Actually, that's what I think it does. I don't know how sure that is. What's your most disgusting case you ever had? Claire Westmoreland's insomnia. Oh, that's why she's here. Belinda Fisher, where are you located? Looks like I'm in the kitchen. Your videos are great, and it's hard to find a good doctor that really cares. True, Lindsay. Got the radio. I don't know if I've read yours before. A friend and I have both used nasal allergy spray and have both had a similar reaction to it. Headache and jaw/tooth pain. Is this common? Coincidence, perhaps. I know of other problems. Well, for one thing, I don't know which medicine you're talking about. When you're talking about a nasal spray, it could be a decongestant. It could be just saline. It could be an antihistamine, or it could be a steroid. So those are all, I would actually call all those a nasal allergy spray. And I can't place any of those as causing those symptoms, to tell you the truth. All right. Somebody please give me a what's it called? Dr. Wayne, what's it called? Super chat, so that I can focus on one thing. So many people. But if I just go just to super chat, then I can't read anything because that's all that comes up. Sports do you like? Yes, Dr. Wayne, cast iron skillets. Favorite sports team? What's the Parkside basketball team? Biologist. No gold shots were a fad and they didn't work. No, they worked. Airsoft is what got me following you years ago. Temexis 13. Hey, you know me from those days. Butterfly Girl, have dealt with hives for a while. It's not caused by any environmental things or any food-related cause. What do you think it could be? It can be any number of things. There's people who can even get hives from cold or sun exposure or water. All sorts of weird things. Trying to remember, I had a friend who had cold pruritus or cold urticaria, where it could be demonstrated by putting ice on his skin, and you'd see where the ice cube was. Okay, something interesting. We'll talk about something interesting here. Some of you may have heard of stigmata. Who knows what stigmata is? I guess I need to go to the end of it here if I'm going to talk. Well, okay, I'm going to miss a lot of your comments and questions there because you're not using Super Chat. Stigmata, where there's actual like writing on people's skin, or the wounds of Christ appear on their body. Some of you guys know what this is. Well, this can come from a disease where a person has a symptom called dermatographia. Dermatographia is where when you put something sharp on the skin, it can be a fingernail, like writing on the skin, give it a little bit of time, probably less than a minute, and you see raised red lines wherever the pressure was. Now, of course, you can do this on anyone if you scratch sharp enough. That's a scratch. Dermatographia doesn't have to be sharp. It can just be something fairly pointed that doesn't leave a mark on normal people, and then this stuff will magically appear. That's pretty cool. Don't know why I thought of that. One of you guys, yeah, somebody was asking about the religious marks. So the reason it's got the religious significance is you take something like the Exorcist. So some of you guys know of a movie or a book related to a particular case. Well, you may not know it was an actual case that this story is based on. It occurred in St. Louis, and it was priests at St. Louis University who were involved in it. So I went to medical school at St. Louis University. Somebody asked that earlier. And in psychiatry, I asked a question about, I think the question was about demon possession. I raised that topic up. And the attending, the professor, laughed, but then he caught himself. Jewish professor, I don't know if that's significant or not, and then he said, oh, there was that case. And what grabbed his attention, his memory, was the stigmata that occurred in the Exorcist case, which now we know, well, that could have been written there and then appeared before people's eyes, showing these different places on the body or actually writing words. It could have been done beforehand if a person had dermatographia. So there's an potential explanation for it. Okay, let's get caught up with your comments and questions. Audrey, what is Super Chat? Super Chat, I think, is available to everybody. It's where when you put in your little comment, just like you wrote, what is Super Chat? There's a little dollar sign. If you hit that dollar sign, it'll ask for a dollar amount. And when you put in a dollar amount anywhere from $1 to $500, it'll put your comment up at the top. Or, no, it doesn't put it at the top. It outlines it with a color, and it stays. Instead of disappearing as it goes up, it stays for everyone, including me, to see for a certain amount of time. So that makes sure that we see your comment or question and we address it. Again, I may not answer every single question a person asks if it's too personal on them, and that'd be practicing medicine over the internet. I don't do that. Or too personal on my end. I may not do it, but I will definitely give it my attention. Okay, Jeremy Miller says, my psychiatrist has me on multiple antidepressants and multiple tranquilizers. Is this common? They do use a lot. Oftentimes we'll refer difficult to treat cases to psychiatrists when it gets to the place where we're using one, maybe two agents, and we're just going, this is beyond my depth. And so we'll have the psychiatrist jump in. Now, at the same time, we'll also see some people prescribe multiple medications for somebody who came in with one thing, and we look at it and we say, well, he's just countering the effects of this one with this, and then he's having to add another one because of what this is doing, and then you'll see a person on 5 different medicines, and they'll actually be worse because of it. Other times they'll be better because of it. I don't want to make a blanket statement that every time somebody's on 4 or 5 medications, it's bad. Usually it is. And chances are it is, and chances are that they're getting more problems from the medicines than help. But not every time. There are some people that really need help, and that is the best solution. I don't automatically think it is, though, just because it's prescribed. But sometimes it is. Okay, King of Here says, hello, how do you feel about people ingesting fluoride in toothpaste or through water drinking with the skin? Do you believe it can damage a person's brain physically or spiritually? Nope, I don't. Of course, too much fluoride could be a problem, but just what you're getting through the fluoridated water or getting through the toothpaste, if you spit it out, certainly won't be too much. You can get upset stomach from it, though, if you did too much. I agree, $2 in the U.S. Not sure what that was. Oh, pound per super chat message is cheap, steep. $1 or 1 pound. 1 pound? Wait, is that pound or is that lira? And it's different in different countries. In the U.S., it's U.S. dollars. Wish my doctor just got more answers and questions I had about myself than my doctor ever gave me. Awesome. Jenny Mueller, my psychiatrist. Wait, do we have 2 Muellers on here? Jenny Mueller, my psychiatrist has me on multiple antidepressants. Oh, yeah, we went over that. Spontaneous bleeding from the hands and feet, just like Jesus had at his crucifixion. Yeah, that's one definition of it. I think it also applies to the writing too. Oh, what just happened? Bad connection. I hope you guys can still see and hear. I've still got 11% on my end, so I can keep going for another minute. Lindsay says fluticasone propionate for the win for nose sprays. Keeps my nostrils open. Yeah, fluticasone is one of them. I think there's another one that may be made out of beclomethasone and triamcinolone. I can't say for sure. These are used in other allergy steroid inhalers. Son gets ringworm on his eye twice a year. It never goes away. Dr. Gawain, haha, stigmata, religious marks. Okay, let me rephrase that. Gold shots didn't work for me. Yeah, there we go. Dr. Gawain, is live chat okay for someone with ADHD? You know what? Are you diagnosing, Dr. Gawain? Can't do super chat over my iPhone. Oh, boo-boo. That's okay. You don't have to. BooBoo Kitty does not have to do super chat to get my attention. She's a patron. Ooh. And so is Lindsay. She's also a patron. And if you guys want to know what that's about, you can go to patreon.com/Auburn Medical Group. And those people get things like this. When you can't get a link to it any other way, they can still find it on Patreon. Actually, it's only the people at $3 a month and higher that are able to do that. My blood transfusion is good treatment for a person with Lyme disease. Could it be nervous-related butterfly girl? DMARDs. There we go. Disease-modifying anti-rheumatologic drugs. Thank you for telling me what a DMARD was. I knew it was some kind of immune modulating. Disease-modifying anti-rheumatic. Yeah, pretty close. Now, Humira and Enbrel. Yes, those are the DMARDs, actually. They're really expensive. And they actually affect your immune system, so you're more vulnerable to infection when you're on these medicines. So you want to be a little more careful around people who are spreading their colds and flu like crazy. Okay, backing up a little bit more. Butterfly girl, I've dealt with hives for a while. It's not caused by any environment. Oh, we did that. Okay, I think we're caught up. So I'll go to the end here. Potato chips, little spash. What is super chat? Stigmata. Trying to get caught up with you guys. Sorry, I meant PDF. Blackhead extraction videos in the future. From Mom Slough. Okay, Mom. I got something to tell you. There's one coming next week. Big one. Good one. Okay, Jenny. Oh, it's Jenny, not Jeremy. There's not two Muellers. It's just Jenny. All right, getting back to caught up to where we are. Sorry for trying to get caught up with you guys. Okay, my son gets... Okay, we did that. Stacy says, got prescribed a lot of meds, thinking of getting my hormones checked and getting to stop taking all these meds. Charlotte, do you think the antidepressants are effective and safe for use in insomnia? Do you think antidepressants... If the insomnia is being caused by anxiety and the antidepressants are being used for the anti-anxiety effect, then yes. Or if they're just sedating. For Super Chat, your patron link is exciting. Exclusive videos. Love your procedure videos. You really paperwork and shows. Okay, for the behind-the-scenes videos, it's not the produced videos. It's stuff like this and some behind-the-scenes stuff. But there's, I don't know, we probably produce... On average, I think we put one up weekly as far as a kind of behind the scenes or a posted live chat like this. Pound sterling, no. And actually, this video, there are no links to this outside of the ones you guys did while it's being done live. After this is done being live, there is no announcement on Twitter or Facebook for this one. The only way you can find this is if you're at the $3 a month level and higher on the Patreon. Just want to make that clear. All right, we'll work from the end here and work back. Okay, Mom Style says, woohoo, can't wait for the Blackhead video. And yes, it's pronounced slaw, thank you. Mom Slaw, there we go. All right, and Audrey, are there any kinds of vitamins good for anxiety? Not that's going to really make a significant effect. And this, this is a topic I talk about quite often, the placebo effect being 15 to 30%. So pretty much anything you take will have a 15 to 30% success rate. But to be better than that, to be better than a placebo in a study, that takes a little more actually doing something. And so I do not know of any vitamins that make significant difference for people having anxiety relief. And Claire's talking to BooBoo. The king of here says, do you believe in circumcision could be an evil measure taken to traumatize people as early as possible? No, because that's what birth is. Mal Yaretz, hi, could you please answer my question? Yes. Shell McNutt, me too, BooBoo Kitty. I really enjoy these live chats. Belinda Fisher, it would be great if you posted new videos every day. You know, I'd kind of like to do that. It probably wouldn't be a produced video. You know, I can only get so many patients. It takes a whole week's worth of patients of a 3 provider practice to come up with 2 videos every week. Lucky them. I have a question about blisters on the bottom and healing. Bottom of the foot? You're good here, doc. Fine here, doctor. All good. Yes. My 3-year-old likes to paint my hallway with... I'm sorry, Claire. What is the cause of widespread issue people have with their teeth? It could be dental decay. Why would teeth be so susceptible to damage? Because of us eating trash. It gives the bacteria lots of fuel to feed upon, and so they can spread like crazy, and we're not knocking them away with the food we eat because we're not eating the rough fiber skins of fruits and vegetables that help to clean. We're eating simple carbohydrates that actually get stuck around our teeth and gums, and then the bacteria have all that food to eat, and the bacteria secrete the acid that decays the teeth. I have a colleague in town. I'll go ahead and mention him, Dr. Miranda. He promotes to his patients what he calls the jungle diet, meaning if you were walking along in the jungle, could you find what you're eating with just your hands and a machete? And if that's the kind of stuff you're eating, then you're going to be okay. You're not going to find a bag of Doritos in the jungle very often, unless somebody left it there. Yes, back to the Doritos, sorry. Temexis 13, on the topic of circumcision, good or bad as a general thing. It's not as prevalent here in the UK as it seems to be with you peeps in the US. Oh, how do you know? Circumcision. So circumcision, of course, came from, well, you've got the religious significance of it with it being a Jewish practice. You've got some people thinking that because it's a Jewish practice and they follow the Jewish Old Testament, that they should be doing it. You've got people who think that it's good to circumcise because it will let your son not look different from all the other boys in the locker room. You've got, oh, what else is behind circumcision? There's so many different reasons. Oh, and then people thinking the lower incidence of cancer of the penis because of circumcision, which to a certain extent is true. If people aren't cleaning it, yes, then there's a higher risk for it and for infection. But if people have hygiene and are clean, that's not the case. So there doesn't seem to be a medical reason for it. If anything, there's reasons not to. That's a lot of sensitive skin in an area that's meant to allow a person to experience pleasure from sensations. So maybe it's not such a good idea to be taking that off of people. But there can be problems later in life. It can get constricted and people can't retract it, and that can cause problems. And that won't be a problem if it was taken off in the first place. You can always do it later, but it's an awful lot easier to do it on an infant than to do it on an 80-year-old man. Okay, I am leaving because my battery is going to turn off any moment now. Love you all. Thank you so much for participating. We'll do it again another time. Seriously considering the Sunday night thing. Oh, also, if you guys have a favorite time, please get that to me somehow in the comments. Would be great. Or comments on another video, anywhere. And I will, don't the foreskin act as kind of lubrication too? There's glands on it, yes. So, but you won't need them if you didn't have it in the first place. Bye, Claire. See you, Stacy. BooBoo Kitty and Lindsay Antoine and Dr. Gwen, Temexis 13 and Jenny Mueller. Thank you so much. Oh, and Austin. See you all another time, and it's been great. Good night.